ICD-10 JJ-10A, page 322, exercise 1. This is a level 2 exercise and it reads like this.
Antepartum supervision of pregnancy in patient with history of 3 previous stillbirths, 12 weeks gestation.
Okay, it's an antepartum supervision of pregnancy in a patient with a history of 3 previous stillbirths, right? And it's a 12 weeks gestation, okay? Now we're going to give you 3 seconds for you to pause the video and give us the ICD-10 code for this. 1, 2, 3. Okay, the answer is there are 2 codes. The first one is 009.921. Notice that the 0 we put the circle with a cross, right? Cross circle to differentiate from the O. And the other code is Z38.12. Okay, so those 2 codes, if you got them, you can just go to the next video. If you didn't get it, let's give you a couple of tips. First tip.
Level 2 difficulty. There are 2 codes.
There are 2 codes, okay? So you have to remember that it's not a simple code, but you have to find the 2 codes. Okay, 2.
3 previous stillbirths means high risk.
Right. Since the lady had 3 previous stillbirths, it means that this is a high-risk pregnancy, okay? Because of the history. 3.
Start with pregnancy. Ignore antepartum in diagnosis.
Right. When you're looking in the index, you're not going to find antepartum. Antepartum is just a way of telling you that it's before the birth. It's not important in the code, okay? Now 4.
Antabular. The first code states first trimester.
Right.
First trimester of pregnancy is week 1 through week 12.
Right. When you're looking at first trimester, that means from the first week through the week number 12. Any of those weeks, that's first trimester, okay? And the last one?
You need a second code to represent 12 weeks gestation.
Yeah, the second code that you need is to represent the weeks of gestation, okay? So that's why you need 2 codes, okay? Now with these steps, you should be able to get the path now for the answer. You know the answer already, but now we need you to get the path, okay? So we're gonna count to 3 and you can give us the path for the answer for this problem. 1, 2, 3. All right, let's go with the full summary of the problem. The problem is antepartum supervision of pregnancy in patient with a history of 3 previous stillbirths, and it's a 12 weeks gestation. There are 2 codes. The code number 1, can you point to the code number 1 through the index is found like this.
First you go to index.
Go to the index.
Then you go to pregnancy.
Go to pregnancy.
Then you go to supervision of.
Supervision of. Then you go to
high risk.
High risk. Remember that because there were 3 previous stillbirths. That's why it's high risk. And now, why is it high risk?
Due to.
Due to.
Then to previous.
Previous.
Then we go to neonatal death.
Neonatal death, which is the same as stillbirths. And the code is
009.29.
With a hyphen means with an additional character, right?
Right.
Okay, so we're going to check this code with the tabular.
First you go to tabular.
Right.
Then you go to 009. That's the first characters you have to check on.
The first 3 characters, which is what?
Supervision of high-risk pregnancy.
Pregnancy, right? Now, add 1 more character. The 2, what is that?
009.2. It's outer poor reproductive or obstetric history.
Right. And then 1 more character.
009.29.
Which is?
History of stillbirth.
Stillbirth. And the last one?
009.291.
Is?
First trimester.
First trimester, which means 12 weeks of gestation. That's what that is the code. Now, it doesn't tell you there that you need an additional code, but because in the text of the problem, it tells you the weeks of gestation, you have to know that we have to indicate this with another code, okay? So the code number 2 through the index is found like this.
First you go to index.
Index.
Then you go to pregnancy.
Pregnancy.
Then you go to weeks of gestation.
Weeks of gestation.
Then you go to 12 weeks.
12 weeks is
C3A.12.
C3A.12 or 12, right? And we check this code with the tabular.
First you go to tabular.
Right.
Then you go to C3A.
Which is?
Weeks of gestation.
And then you get a confirmation that you need the second code because it says code first, complication of pregnancy, and it gives you the first 3 characters of the code that you already have, which is 009, right? So that's your confirmation that this code is necessary, right? Then keep going. Z3A.1 is what?
Is weeks 10 through 19.
10 through 19, and exactly Z3A.12 is
12 weeks.
12 weeks, which is exactly what we want. That's where the equal sign there. So that's the reason for our second code, right? That's a confirmation for our second code. So the answer is 009.291, and the second code is Z3A.12. Thanks for watching, and please visit our website.